and HIV prevalence is almost 2 times higher among women aged 15 to 24 than among men of the same age. Zimbabwe has the 6th highest number of annual adolescent AIDS-related deaths in the world. So many health issues remain a mystery to many women until there's an initiative to deliberately educate women about these issues. Health challenges will continue claiming lives of many young women in Zimbabwe due to lack of basic education on these issues. 2/3 of the population in Zimbabwe is under 25 years, and HIV prevalence is almost 2 times higher among women aged 15 to 24 than among men of the same age. Zimbabwe has the 6th highest number of annual adolescent AIDS-related deaths in the world. So many health issues remain a mystery to many women until there's an initiative to deliberately educate women about these issues. Health challenges will continue claiming lives of many young women in Zimbabwe due to lack of basic education on these issues. Today on Inner Time, we talk health policies in the context of young women. Next. Welcome to In Her Time talk show, proudly brought to you by Say What Youth Organization in proud partnership with Swedish Embassy of Zimbabwe. In Her Time talk show is a platform where young women come together from different backgrounds and institutions to talk about their challenges, hopes, aspirations, and dreams, whilst at the same time we have role models to guide us along the way. Did you know that 2/3 of Zimbabwe's population is under the age of 25, whilst we have the highest HIV prevalence rate amongst young women aged 15 to 24? Today we'll be addressing the issues of health policies. Are they really addressing young women's needs?
Health policies in Zimbabwe still need some work to be done, as there is a gap that they are not addressing, particularly in young women's lives. We talk of how harmful practices such as child marriages and unsafe and illegal abortions that have been affecting the sexual and reproductive health of women. Therefore, health policies in Zimbabwe do need to be addressed, and we need to go back to the drawing board to ensure that we are addressing all the issues affecting women in their lives.
Society is diverse. People have different religions, different backgrounds, and different beliefs. But as a country, we have to have one common ground where we operate from. Hence, I advocate for the involvement of young women and young people in policy making. As this is a cycle, we need to be involved in the processes from the day you start making the policy and from the day you start implementing that policy.
I have young women from different institutions to join me for this conversation, with also our role model, Rarashe Miti, who is the founder of Youth Vibes Africa, an organization that focuses on youth development and youth sexual reproductive health knowledge. I have Menashe with me, who is from the University of Zimbabwe, Kudai from Harare Institute of Technology, and Patience from Harare Institute of Technology. Welcome, ladies.
Thank you.
How are you today?
We are lovely.
That's fantastic. All right, so I'm going to start with Menashe. Let's talk about health policies that are already in existence. Are they really addressing young women's needs?
Thank you, Unique. To start with, some of the health policies are addressing women's needs on paper. Like they do mention and address women's needs on paper, but you find, like, for example, the Termination of Pregnancy Act. It states that you can abort your pregnancy if the mother is exposed to danger, or the infant is going to be exposed to danger, or after rape, right? But you find that sometimes then in implementing this policy, someone might be raped today and the court case takes something like 8 months. And by then it's too dangerous for someone to actually abort the child. So yes, the government can say they are implementing the policies in that the court granted you the access to go and abort, but medically you can no longer abort. It's not safe anymore. So somehow we can't say the policy is actually okay.
Kuzi, what are your thoughts around, young women's needs being addressed in today's health policies in Zimbabwe?
I agree with what Menashe was saying. Some of the health policies, it's just paperwork, and then there's no action that is being taken to apply it. Like the National HIV and AIDS policy, whereby they are saying that in every person in the country is allowed access to some pills and they are available at the hospitals. But then if you go there, you ask and then they say they are not available, or you have to pay. They're actually available. It's allowed to get it for free sometimes. And if I'm encountered to danger, let's say for rape, if a person is encountered in rape, they are supposed to get the PrEP to clear out the issue of HIV and AIDS. So as I was saying, they're actually saying it on paper, but there is no action. They are not applying it in reality. It's not happening.
Patience, we're talking about, documents gathering moss in offices. Yes. Do you agree with this, argument that obviously Menashe and Kuzi have already put forward in terms of, policy looking perfect on the papers, but actually in reality, that's not what's on the ground?
These two ladies are correct, Unique, because you find the issue that, yes, we have documents, they're very specific. They will say that if you are raped, you can apply to abort. Yes. But then the issue is the implementation of it, the swiftness of the implementation. Right. It takes ages to reach a conclusion. So action is very slow to take place. The uptake is really slow. As a result, you find that the extent to which these policies are being implemented is very poor. And we have gaps that are not being covered by these policies. We talk of child marriages. Yes. We talk of harmful practices such as castration of genitalia. And you find that there are not enough policies addressing these issues affecting young women in remote areas that do not have access to, let's say, clinics or health services that we in the city have access to readily. Yes. So you find that in as much as we can say there are policies that are there to help young women, to what extent are they helping them? You find that it's more of a pull and push type of situation. If I want to get an abortion, I can get it. But the process to which I have to go through to get that abortion, it takes a lot of time. That's when you find that most people now opt for illegal abortions. Yeah. And the mortality rate is 32.5% for mortality for women who are dying from illegal abortions. So are the policies really addressing the issue at hand, or they are just giving us a picture perfect of what is going on, but not really addressing the issues on the ground?
Ruva, I know that, you as a young person, you've been actively involved in, fighting for young people's rights, especially when it comes to sexual reproductive health, knowledge, and so much more in women's rights. What are your thoughts around what is happening in terms of policy making? Can we say that this is an inclusive process that's, inclusive of young women's needs?
Okay, so thank you so much for having us on the show, and I like it. It's in her time, so it's good that we are discussing this issue. So yes, policies are there and they'll always be there. The inclusive part of it. I'm glad to say that young people are always involved. Say for example, the ASH strategy policy. Most people, they know it from ASH 1, ASH 2, the strategy policy. I'll mention maybe the likes of National AIDS Council, involving young people from all the provinces in Zimbabwe, being the voice of the voiceless within their provinces. So this strategy was actually involving young people to say, what are the issues that you are facing and how can they be addressed to? So young people were really engaged, I would say, for issues like abortion that has been mentioned, issues like access to HIV, drugs, access to even services, proper services for young people. Young people were the voices saying we need these issues to be involved, to be articulated in the policies that we are having. So we have one that is already coming to an end, the ASH strategy of 2016 to 2020. That strategy alone cements almost 3/4 of the issues that young people are facing in Zimbabwe, specifically for the young girls in Zimbabwe. So the inclusive part of it is being involved in saying that they were asked questions, and they did respond to the questions. And they also were involved in actually pilot survey to really see and say, are these issues really happening for young girls in our community? Say, for example, the child marriage issue. It is really happening in Zimbabwe in various provinces, and we can simply point to say, okay, the issue of child marriage has been happening in this area, so what has been done? So through the policies, a bill has been passed in Parliament, and now we even have an act, a guiding law policy that is already being cemented within our government of Zimbabwe.
All right, well, after the short break, we'll continue this conversation. As we already said, according to the UNAIDS, young women aged 15 to 24 have the highest HIV and AIDS prevalence rate. And we asked the key question, where are we missing it in policy making? We'll be right back. Welcome back to In Her Time talk show, proudly brought to you by Say What Youth Organization in proud partnership with Swedish Embassy of Zimbabwe. We are talking about health policies in the context of young women. And of course, we're asking, the key question around the challenges that young women are facing. And I have with me two ladies from Harare Institute of Technology and one lady, Munashe, from the University of Zimbabwe. We have Kudzi, we have Patience, and we have our role model, Rarashe Miti, who is the founder of Youth Vibes African organization that focuses on youth development and sexual reproductive health rights. Welcome back, ladies.
Thank you.
So just before the break, we were talking about, just asking these young women and of course our role model if, our health policies in Zimbabwe are really addressing, young women's challenges. And of course, a lot of these young women say, no, not really. It looks perfect on paper, but in reality, that's not really what's going on the ground. So I'll start with Ruva. Where are we missing this whole issue of addressing young women's needs when it comes to health?
So firstly, I'll say it's involvement. Because if young women are not involved, they won't know. Because knowledge is power. So if they have the knowledge to say what policies are meant for them, tailor-made for them, and they understand them, the better it is. Rather than having a young girl or young woman who's in any Zimbabwean setup who doesn't even know the policies. So right now we're simply saying young women should get involved, like on platforms like Web for Life, Say What, getting engaged, because Say What can't pull young girls from the streets to say, come and join our club, come and understand what is happening, because the information is there. They have it through IEC material, they have it in their resource centers. So if young women are interested in a particular topic, say abortion, say HIV, say teen pregnancy, say relationships, anything, any topic, because all of these topics are in the policies, they are spoken about. And after all, the policies are cemented or they are approved by the permanent secretary of Ministry of Health and Child Care. So young people should get involved, because if they are not involved and if they do not seek the policies to really understand what is happening on the ground, they won't know and they won't be engaged. So as I always say, opportunities for young women, they don't just come knocking, but sometimes you need to seek those opportunities and see how best you can fit in the policy and be the voice of the voiceless.
Patience, going back to what Ruva is saying, she's talking about, young women, having to access information, or there's a bit of a challenge in young women actually accessing information. You are at Harare Institute of Technology. Is there information for young women where they get to understand their sexual reproductive health rights, where they can understand where they can get protection and all that?
Yes, the information is there. I will not lie. It is there and it is accessible.
Yeah.
But the issue comes now on how accessible is it?
Right.
Because you find that who is making it accessible to these young women?
Right.
Let's say you want to get family planning, you want some contraceptives, you want HIV and AIDS medication.
Yes.
For you to go and access it, the people who are disseminating that medication or that information to you are in generation above you.
Yes.
So then comes the issues of, well, you are only 18. What do you need family planning for?
Right.
You're barely out of your teens. What do you need this and this for? So you find there's a stigma attached to just approaching and say, I need condoms.
Yes.
Why do you need the condoms? There's a lot of morality that now comes into play where there seems to be a judgment factor, where they're judging you now and you don't feel as comfortable and you're not as open to going there and accessing that information because it's tabooed. Everything, you find that if you want it in our African culture, it's, well, you're not married, you're still in school, what do you need this information for? So there's now a lot of ignorance around these areas simply because people have the fear of going and accessing that information. So what we need to do now is to break down those barriers that are stopping young women from accessing their correct and rightful medication and information that they need to understand themselves sexually and reproductively better. So the issue now comes in, how then can we break down these barriers? How then can we make sure that not only for me, a student at a tertiary education, but other young women who do not have the access to education, be it secondary or even tertiary, young women in the rural areas, in remote areas, in different provinces that do not have the advantages that I have as a university student.
Going back to what Patience is saying, she's talking about an issue of culture versus policy making. And unfortunately, we have policy makers that are creating these policies that are also mothers and fathers within, their own households. How do we balance out policy and culture? Because policy is saying that, when you're 16, you can have sex. When you're 16, you can access information and you can go and get protection. But then when we come down to culture, it's like, no, it's not going to happen. How do we balance that out?
Looking at the policy that was amended 3 days ago, the Education Amended Act, there was debates. The people were saying, how can you allow a girl who is pregnant to continue with others? What is your aim? Are you trying to spoil the other children, to say it is okay to have pregnancy and then continue with education? That fear, the parents are making them, they are saying, I can't do that. What, even the child, how will she feel having lessons with someone while she's carrying a child? So what is happening is that the culture, of course, what about if we access to the children, are they okay with it? Maybe someone is not affected. What's the period that you take the pregnancy to 9 months? Some people are going to get a knowledge. So they need to continue at that period. But then the issue like that will happen in the class, like, I can't sit near to this child. You are then separated from others. You are then feeling uncomfortable. So we are saying that in as much as we are looking at the culture, that is, say, the fear of the society, what would they say? Is she comfortable with it? Is she all right with it, with the education continuing or doing whatever, besides looking at the society, what they are saying?
Munashe, what are your thoughts around this? How do we balance policy and culture? Because surely, within the community, I'm trying to go to, youth-friendly center or a clinic that I'm hoping is youth-friendly, but the responses that I'm getting are totally contradictory.
All right, what I think is we have to normalize talk on our sexuality, because once it's normalized to talk about your sexuality, then you are free and open to reach out to the next person when you have a problem. I'm afraid our culture makes it a taboo to even talk about your sexuality, even issues of menstrual health, which have nothing to do with you but are just a biological makeup. You find that you'll be very reluctant to even talk about it in a family setup. But this family, you find that in this family, these parents are also probably those people who are going to be part of policy making, like you're saying, if they hold such positions. So the barrier that we actually have to address is of society, involving society in policy making. What I'm saying is, you find that I'm doing engineering, but we are forced to have a communication and skills course, because we need, in as much as I'll be an engineer at work, I'm going to be a mother at home, and you won't know it when I'm walking in the road that I'm coming from work. So I need to be presentable, right? So I feel like issues on sexuality should be actually added to the curriculum, so that as we are growing up, we're normalized to speaking about these issues, such that when we then want to address or to access these services, you feel like you're just talking about accessing a condom and it's not really something taboo. And also on the issue of involvement that she was talking about, I would like to commend the government and the policy makers these days, because they are actually making an effort to have young people included in policy making. But I would like to address one important issue that I've noted, that it's not just about involvement. How are you involving us? Because thanks to Say What, I've had a chance to be on platforms where young people are said to be part of policy making. But you find that in some of these spaces, I'm literally there to fill in the register. And they say that we had a youth representative from the University of Zimbabwe. But I don't feel like I contributed anything to the meeting. When we are saying we are involving young people, how are you involving them? Are you involving them in making the policies or in putting them on the register so that when it will be then asked, you say we had a young person in the room?
After the short break, we will end our final segment in asking and addressing the key issue around policy making and young women's challenges within health policies. And of course, we'll be asking the key question as to how women can be more involved in policy making and if they actually know the policies that are there to help them. We'll be right back. Welcome back to the last segment of episode 2 of In Her Time talk show, a space and platform where young women can come together and talk about their challenges, hopes, aspirations, but whilst we're also bringing solutions to the table with role models guiding us along the way. This program has been proudly brought to you by Say What Youth Organization in proud partnership with Swedish Embassy of Zimbabwe. Just before the break, we were talking about the challenge around policy making and if young women are involved, of course. And we're also discussing issues to do with culture versus policy. And right now, on our last segment, we're going to be talking about, the way forward. How can we address the challenges that we have at hand? And if young women actually know the policies that are there to protect them and that are there to better them in terms of their health. And I'll start with Patience. Patience, what can be done as a young woman? I mean, Menashe, just before the break, was talking about her being involved. Of course, she's there. She's just there to sign. And then, people are taking pictures and, they're like, yeah, young people were there. But how do we effectively make sure that young women are actively involved in policy making on the things that affect them on a daily basis?
Yes, on that part, we will have to look into getting actual representatives that have a wider scope of range in understanding issues of young women who are young women themselves. We are not just talking about students from universities who have only experienced the ordinary city life where they're just going to the university and getting their education easily. But we're talking about people with experience from different backgrounds. We're talking about a rural background. We're talking about a city background, as well as other numerous backgrounds. Once we have those representatives, we need to make sure that they are comprehensive and that they completely understand what it is that is going on. And once we have made sure that they are part of it, we will look into, let's say, reviewing policies every now and again to make sure that in the space of 6 to 8 months, what exactly was done. We have, let's say, annual reviews where we speak on, okay, so we put in place this policy to address such and such an issue. What are the results? What's on the ground? What records do we have to prove that this was effective? And if it is not, we fine-tune it to find a way to make sure that it is effective and it is having the scope that we wish it to have. Because if we just say, well, we formed this strategy, this policy 8 years ago, I'm sure it's working, when you don't have any proof to say, well, how is it working? You see, and we also need to look at making sure that the people who are actually disseminating information according in relation to these policies are young people themselves. Because it doesn't work for me to say I was there, we made this policy, and yes, we made sure that it is available to all the women, but the people who are disseminating that information, they're a generation or a couple of generations above. Yes. They do not understand the issues. They may try to, but it's very different from a person who's on the ground. I can easily understand an issue being faced by another young woman, let's say in her teens, as compared to someone who's in their 60s. There's already a difference there in mindset and approach. So if we make sure that the policy disseminators are young people, the policy makers are also young people, and the policy reviewers are young people, then I feel that we may make progress in making sure that policies are working for their intended purpose.
Ruva, it's interesting. Patience is talking about the young woman in the rural areas. And I'm very concerned about that young woman because, yes, I mean, we have junior parliamentarians, but I mean, can we say that young women in rural areas, their needs are actually being addressed? Because they could be completely different, you know, from the urban girl's needs, if you know what I mean. I mean, she's talking about, of course, we're talking about sanitary way, but there's so much more happening, and she might not even have access to information. How are we reaching out to young women within rural areas?
Okay, so the funny thing why I laugh is because most people, they always say rural girls. But people should understand that rural is just a physical setup.
Okay.
You can be referred to as rural because you are in Harare. You understand? And there's a place called Murewa, but it's just a rural setup. So when we say rural girls, already it's a problem. But we are saying young girls living in the rural setup. So that's a correction that needs to be said to all the young girls out there. So the funny thing also with us activists, advocates, we always refer to say rural areas, saying not even being there physically, which is a problem. But however, I'll simply say in my experience and in my walks, because I engage with young girls living in the rural areas, say for example with Rosaria Memorial Trust, they have well ventured in that, and it's one good organization that is working on that, as well as Roots Africa, working with young girls living in the rural areas. But you'll be surprised, these young girls, they've got centers, youth centers, nangas, they have mugota, they have spaces where they meet up and they are given information. There is ICT. You'll be surprised that there is ICT. There is IEC materials. Because remember, as organizations, we set parameters to say, okay, we are dealing with this area. You understand? So information is there. And I think it is up to us now to decide whether we want to always continue to say rural girls are left out, information is not there. Have you ever been there in the rural area and be able to see what is actually happening in those rural areas? Because information is there, of course. The government has done so many strides to have rural electrification, sending ICTs or computers in the schools. And some might say, they are not working, or it's a lie, things are not happening. But I'll give an example whereby we do our field trips in the rural setup, where we go there and you'll be surprised the information that they have, the zeal that they have, and the aspects that they have towards certain issues. To say, yes, if I'm a girl, say for example the menstrual issue, they know that if I have come to this age, it means that I'm mature. I need to take care of myself. I shouldn't indulge in any sexual indulgence, and I should be protective to myself. And if I do not have anyone to speak with, I need to go to the school counselor. I can speak to Gogo Ningi or Auntie Ningi who stays in a certain area. So sometimes it is wise to have some exchange programs, especially for girls from HEAT or UZ, to actually go there and be practical and see what is really happening. And them also, the girls living in the rural setup, to also come to Harare and see how the girls probably at HEAT or UZ or Catholic University are behaving, because it's just a matter of the setup that we have. But you'll be surprised that the information is the same. It's how we accept the information and actually use the information. So basically that's it. And young girls, I would simply say in Zimbabwe, all girls are the same, if I may say. And it's only that access to the services, or maybe the affordability of the services, might differ from one place to another.
Okay. Munashe, let's talk about young women actually being aware of certain health policies. Are we well versed with the policies as young women?
On that, allow me to actually say, are we actually all well versed on these policies? Is everyone, like the whole society? Yes. Because you find that the other problem you're having with the implementation of these policies, like you're saying, is lack of information. Right. It's not only the young people who need to know these policies. Let's say there's been talk these days on the issue of getting married, right? I realized sometime later when they were saying lobola is no longer a requirement, whatever. You find that, let's say I'm a young woman and I've grasped that concept, right? But my parents do not know about the existence of such a policy. And it's then time for me to get married. I have agreed with my boyfriend that he cannot pay lobola for me, right? It's going to be a problem when he gets home because my parents are not aware of this policy, but they are living in Zimbabwe and it's an existing policy in Zimbabwe. It calls for collaborative cooperation from the whole society so that these pastors do not disseminate the wrong information because they are already shutting down the women's voices in that, because now I'm afraid to be judged just because I have period pain, but it's not something that I can control. But because I'm being labeled demonic, it affects my future and I tend to then shut up and risk my life. So I think it calls for cooperative collaboration from everyone, not only young women, not only policymakers, but even our families as well.
What are your thoughts around what Munashe has just said? She's talking about, the policy-making process and helping people understand the policies within institutions, within communities, and of course within the religious circles. Can you say that we need to start acting within our own circles in order to help young women and just everyone else understand the policies?
Yeah, charity begins at home. Trust me, if I didn't go to an university and do a program that have law as my own module, I couldn't even know there was Public Health Act, Termination of Pregnant Act. So to others, it is, I can say, the people, starting from the churches, people should stop discriminating, whereby they say there is a service like China, where there are ladies meeting to talk about their problems. If me as a youth, I stand out and say something, they'll say, so that becomes a problem. I'm not free now. How do you expect me to know something if you are preventing me from the knowledge? You are saying that I'm still young. Of knowledge begins when I'm growing up. I need to know something when I'm growing up. So the people should stop discriminating. I think discrimination is a problem, whereby we say as long as you are below the age of majority, 18, you're not allowed to hear this information. The parents have that fear that I should know, barrier, where we are saying that if you know this knowledge, if you are taught that how to wear a condom, what are you going to do next? Are you going to try it? That's the fear that we have. So knowledge, I think we as a country, we should encourage that people should know law as it is. Because they know a Panama, there's the national AIDS and HIV policy. People don't know. I didn't even know. If I could even study and do law, I couldn't even know that. So people should educate ourselves with law to be familiar with what is happening in the country.
All right, well, thank you so much. And of course, we've just reached the end of our second episode of In Her Time talk show, proudly brought to you by Say What Youth Organization in proud partnership with Swedish Embassy of Zimbabwe. At the end of the day, we're saying that young women should understand the policies, but not only young women, because young women are coming from within homes, they're coming from within institutions, from within religious sects. So at the end of the day, we're saying that everyone should understand about policies. Today, we're talking about young women's challenges within health policies and how we can address these challenges. Thank you so much to Aruba, our role model, for coming through, Munashe, Kudzi, and of course, Patience. Have yourself a fantastic day. See you next time.
In Her Time to me means a platform where women can finally talk about the socio-economic issues affecting them and in their lives. A platform where women in a safe and secure space are able to express their ideas.
In the past, girls were used to speak their problems to their aunties, but then their aunties would end up judging them. That fear of embarrassment that comes into the girls, that's what we are bringing out in Her Time. Come here and bring out your voice. Be heard.
The beauty of life is that it's dynamic. We're constantly changing the way we do things. So In Her Time for me centralizes on me. What is happening in my time? It's like a recording of what is done in my time so that other people will get to know what it is that happened when Munashe was living.